Colon cancer warning signs and symptoms you shouldn't ignore. Colon cancer is a growth of cells that begins in a part of the large intestine called the colon. The colon is the first and longest part of the large intestine. The large intestine is the last part of the digestive system. The digestive system breaks down food for the body to use. Colon cancer typically affects older adults, though it can happen at any age. It usually begins as small clumps of cells called polyps that form inside the colon. Polyps generally aren't cancerous, but some can turn into colon cancers over time. Polyps often don't cause symptoms. For this reason, doctors recommend regular screening tests to look for polyps in the colon. Finding and removing polyps helps prevent colon cancer. If colon cancer develops, many treatments can help control it. Treatments include surgery, radiation therapy, and medicines, such as chemotherapy, targeted therapy, and immunotherapy. Colon cancer is sometimes called colorectal cancer. This term combines colon cancer and rectal cancer, which begins in the rectum. Risk factors. Factors that may increase the risk of developing colorectal cancer include age. The risk of developing colorectal cancer increases with age, with most cases occurring in individuals over 50 years old. Family history. A family history of colorectal cancer or certain genetic conditions, such as Lynch syndrome and familial adenomatous polyposis, FAP, can increase the risk. Personal history. Individuals who have had colorectal cancer before or certain types of polyps are at a higher risk. Lifestyle factors. Unhealthy lifestyle choices, such as a diet high in processed meats and low in fruits and vegetables, sedentary behavior, obesity, smoking, and excessive alcohol consumption, can increase the risk. Symptoms. Colorectal cancer often has no symptoms in the early stages. Regular screenings are important to catch the disease early and begin treatment. Common symptoms include changes in bowel habits such as diarrhea, constipation, or narrowing of the stool. Blood in the stool, rectal bleeding, either bright red or dark and tar-like. Abdominal cramps, pain or bloating that won't go away. Unexplained weight loss that is sudden and losing weight without trying. Feeling constantly tired and lacking energy, even with enough rest. Iron deficiency anemia due to chronic bleeding, causing fatigue, weakness and paleness. Changes in your poo, such as having softer poo, diarrhea or constipation that is not usual for you. Needing to poo more or less often than usual for you. Blood in your poo, which may look red or black. Bleeding from your bottom. Often feeling like you need to poo, even if you've just been to the toilet. Tummy pain. A lump in your tummy. Bloating. Feeling very tired for no reason. Stages of colon cancer. Doctors use staging as a general guideline to help them determine how far along the cancer is. This could help them develop the best treatment plan and better predict your long-term outlook. Stage 0 colon cancer is the earliest stage, and stage 4 is the most advanced stage. Here's how the stages are defined. Stage 0, also known as carcinoma in situ, this stage involves abnormal cells that are only in the inner lining of the colon. Stage 1, the cancer has penetrated the lining, or mucosa, of the colon and may have grown into the muscle layer. It hasn't spread to nearby lymph nodes or other parts of the body. Stage 2, the cancer has spread to the walls of the colon or through the walls to nearby tissues, but hasn't affected the lymph nodes. Stage 3, the cancer has moved to the lymph nodes but not to other parts of the body. Stage 4, the cancer has spread to other distant organs, such as the liver or lungs. What causes colon cancer? Researchers have identified several contributing factors to colon cancer, but it's still not clear how exactly they work together to cause colon cancer. These factors include inherited and acquired gene mutations. Environmental factors and dietary choices can also play a role. Nearly all colorectal cancers begin as non-cancerous, benign, lumps, polyps, in the lining of the colon and rectum. These can slowly develop into cancer. You have a higher risk for colorectal cancer if you are age 45 or older, drink alcohol, smoke tobacco, are overweight or have obesity, eat a lot of red or processed meats, eat a low-fiber and high-fat diet, have a diet low in fruits and vegetables, have colorectal polyps, have inflammatory bowel disease, Crohn's disease or ulcerative colitis, have a family history of colorectal cancer. Treatment. Treatment depends on many things, including the stage of the cancer. Treatments may include endoscopic surgery, less invasive surgery using a lighted, flexible tube, surgery, chemotherapy, radiation therapy, immunotherapy, targeted therapy.